The theme of this is why not? They asked me to do it. How many of you had fun last night? Was that a great night? We were going to ask Dale to come back to the Drum Cafe to do an encore, but they had to leave early, so they volunteered me. But my hand, who has sore hands? I get bruises on my hands. But also, Wade and Susan asked me if I would be the guinea pig or subject matter for this morning's Facebook blog photo. So if you ever want a chance to take a picture, here it comes. Okay, let's get serious. I can't suck my gut in that long, folks. I can't talk and do that. Welcome. Thank you so much for being here. What a great, great morning, a great evening last night. I am in awe of you and those who help us to put this on. It is amazing what it takes, this village of relayers to put this on. It's an honor to be here. I'm always thrilled to follow Rule and hear what he has to say about where we are in Relay. Not just dreaming big, but truly taking Relay after 27 and a half years, and I believe at the time of our history where we have the opportunity to take it to the next level, to do something different, to get creative. You heard Dr. Klatt talk about being creative. We must do that. We owe our communities to do that. So I'm thrilled to be here. But you know, the American Cancer Society has been full of dreamers for many years. And we're now 4 months into our 100th birthday. But can you imagine in 1913 what they were dreaming of? Back then, there were no survivors. No one survived cancer. But today we have almost 14 million cancer survivors around this country. We're the largest not-for-profit health organization in over 6,000 communities, 3.5 million grassroots advocates. We're always open, 365 days a year. I don't even think they could have dreamt that back in 1913. But here we are because of you and the millions of other relayers around the world. Now, you've heard already, Relay has a history of dreaming as well, and I won't go through specifically the start of what Dr. Klatt did, but you may not know, in 1996, 11 years after he started Relay, we were raising about $60 million annually. And Dr. Klatt challenged the American Cancer Society that we can do 100 million. We thought he was crazy. I personally thought, where's this guy coming from? But only 2 years later, not only did we surpass $100 million, but you saw what Rule shared where we've come from. That's about dreaming, and you can see it's relays all over the place. Rule shared with you the Kilimanjaro example. Relay's gone to the dogs. I mean, we can do about anything with Relay, if you take nothing back home with you this weekend, it's just to have that creative spirit. What can Relay do in your community? Well, as I was researching and preparing for this weekend, you know, we've actually changed the vernacular of Americans. We call ourselves relayers. We go relaying. And I wondered if these were even words. So I went to a book I haven't been to in a long time. I went to Webster's Dictionary. How long has it been since somebody went to Webster's Dictionary? I tried to find if these were really words, and I couldn't find them. Relaying, relayers, not in the dictionary. But you know what I did find? And I'll let you look. Now, is that cool? Is that cool? Okay. Before you get too excited, I will admit that's Steve's abridged edition. I did add that, but I fully expected to find it. And I believe in the near future, when it's edited in the future, it will say it. Matter of fact, if we're going to dream, in my lifetime, I hope that this is the definition we'll find in the dictionary. But again, the ACS, when I think of when I started 30 years ago, it's about at 1.0 down there. We were an very specific community organization with a lot of women walking door to door, passing out educational leaflets. And that's about what we did. That was our charge. That was our mission. And look where we've come from now to be the most highly visible organization, and even tomorrow being the leader in the global fight against cancer. It gives me goosebumps just thinking about where we are. Now, here's a great graph. I mentioned the 14 million survivors. The red, that's not the kind of graph we want to see for relay income comparisons. But look at the red line of cancer mortality. We've heard it before. Since 1992, cancer deaths have been on the decline. And what does that mean? That you may not be able to see all this, but basically men and women, basically since 1992, 1 million deaths, cancer deaths have been averted ever since the decline started to go down. That's 350 Americans a day. And we believe that we just do what we know how to do, we can get to 1,000 lives a day and eventually 10,000 lives a day globally. That's the dream of our organization. And I don't know that it's that far out there. But how are we going to do that? Our Chief Executive Officer, Dr. John Sefrin, says this is the roadmap. This is what we have to be able to do. We have to be able to prevent the cures that are preventable. And half of all cancers are preventable. Think about that. Half of all cancers are preventable. If we just do what we know how to do, we've got to be able to treat those that are treatable. We do have to fix the system, the access to care system and our healthcare system, and we have to be able to provide state-of-the-art palliative care for those who need it. Now, simple, it's easy to read. It's not easy to do, though. But we know the roadmap's there. If we follow it, we can get there. But what's it going to take? Well, this is going to be a no-brainer for all you resources. This is where you come in. Human and financial resources, must have them. And what you do back in your communities, getting one more, asking one more person is what it's going to take. We also have to collaborate. You've heard already this morning about where we stand in the nonprofit sector and the research field, but we must work with the profit sector and the public sector to make sure it happens. And our friends at ACS CAN working hand in hand with them to change policy. I mentioned about the 100th birthday coming up next May. Wanted to share a little bit about what's going on. There's actually work currently being planned to put together a celebration that's purpose-driven. It's going to celebrate the past, but more importantly, embrace the future of where we can be. We're going to leverage the birthdays campaign. That's a no-brainer. And then we have to make sure, and I hope this comes to fruition, that you can replicate it in your community. Now, there's a lot of work to be done. We should already have that ready for you. But when it is ready, we'll make sure that that can be launched. Next May is our birthday, right in the heart of the season of relay season. And what are those desired outcomes? Again, to position ourselves as the organization that's going to help in this epidemic in this century. We want to make sure that we increase the knowledge of folks of what our accomplishments are. There's still a lot of people being affected and dying from this disease, but we have to be able to celebrate the accomplishments that we've made. And it's going to help us raise funds. We must leverage that as we move to the future. So I'm pleased that we're able to actually share with you we have a 2-minute video to give you a sneak preview. It is not for public knowledge, but it'll give you a little idea of what we're going to be doing as the 100th birthday celebration comes forward. Again, thank you. My name is Steve Zamzow. I dream big, and I'm proud to be one of your relayers. Thank you very much.